Well, I'd like to introduce Dr. Lichtenberger. He's a double board certified facial plastic surgeon. He does reconstructive surgeries as well, and he's an ear, nose, and throat specialist. He's going to come up and talk about some of the surgical options and give some really incredible before and afters that are all his work. And so without further delay, Dr. Lichtenberger.
Thank you, Chris. I appreciate that, and really I have to say thank you to so many people tonight. Many of them are sitting behind you there, right in front of the cameras. First of all, again, I really feel fortunate working with Chris Stacy. I trust him in so many different ways, both as a coworker, a friend, and a race partner, if you can believe it. He and I have been on the same ski-to-sea team for a number of years, and I don't know if any of you have been able to participate or at least spectate on that race, but it's coming up soon. So keep your eyes out for Fletcher's Friends, which is our team this year. My puppy's name is Fletcher, so that's how we got the name. So again, I know Chris kind of gave a nice little overview of some of the injectable treatments that we're able to do in the office. Did anyone have any specific questions with that, or any questions that were brought up by some of the photos? So the question is, there's so many products out there, which one is for me? And it's a great question. And looking back at some of those photos, we used specific fillers or Botox or some of the other neuromodulators in specific areas for a variety of reasons. There are some fillers that are meant to be used in specific locations, and I think Juvederm Voluma, which Chris showed some really nice slides on, I can go back to those, such as this example right here. Juvederm Voluma is really made to be used right in here. And I think when he spoke of the triangle of youth versus the pyramid of age, that's really a key area to try to change the appearance from volume down here to volume up here in the cheeks. So take the volume away along the jawline, move it up to the cheeks. And that's a great example of one use of Voluma, for example, which really does benefit the cheek area, but can't be used in a lot of other areas due to its consistency. Essentially, the key is that we will have to do an assessment, and that's a big part of the process, which I'm going to talk about a little more in a second here. There was another question? Excellent question. The question was, with repeated treatments of neuromodulators, what is the effect? Do they accelerate over time? Do they diminish over time? Am I kind of stating that correctly? We've noticed a few different patterns. I have some patients who come in maybe twice a year and get a little Botox perhaps in between the eyebrows, and they see some great effects. They wear off after 3 or 4 months, and they pretty much go back to square one. What we found is with, especially up front, consistent treatment every 3 or 4 months, so 3 or 4 times a year, the brain kind of forgets about those muscles. So first of all, they don't come back as quickly after that sort of almost loading period is a way to think about it. They don't come back as quickly, and they don't come back as strongly. So those patients then might find after 5 or 6 months, they're really still not noticing as much movement or as much of the lines. Another question I get asked a lot with regards to that is, oh, well, can I keep using this for years and years and years? And that's one thing we have found, that these are extremely safe, especially in the dosages we use for cosmetic purposes. I wear 2 hats, as Chris mentioned. One as a facial plastic and reconstructive surgeon, one as an ear, nose, and throat. And with both of those, I see a lot of different patients for a lot of different reasons. I use Botox very commonly for things like migraine headaches, TMJ problems. And with those patients, I'm using upwards of 10 times the dosages that I use for a typical cosmetic patients. So really able to see the effects of huge doses. And they're still pretty minimal. There are some effects that happen at those dosages, which are a little different than at cosmetic. So thanks for that good question, though. Another one in the back? Yes?
You mentioned the migraine headaches.
So for migraine headaches, the question is, where does the Botox get injected? And it's an area that it's really exciting, because 15, 20 years ago, when a lot of facial plastic surgeons started finding that their patients with migraine headaches who they were treating with Botox said, hey, my migraines are so much better. I think it's due to the Botox. They said, oh, well, let's look at this. And many neurologists kind of said, that's impossible. Migraine is due to blood vessels in the brain and scalp. And now there's a lot of neurologists who are using Botox for migraine headaches as well. Some of the treatment areas are the same that I use for cosmetic purposes, in between the eyebrows, kind of sometimes in the corner of the eyes or in the temples, in the forehead. And there are many places that I inject that are not really cosmetic, along the neck and even some of the muscles that raise the shoulders. All right. Any other questions about some of the injectable treatments? Oh, Jessica's reminding me that we also treat the underarms for sweating, and another area that I treat is also kind of another combination treatment for Botox, which is in the jaws for both sculpting the jawline. Some people have really strong muscles of chewing called the masseter muscles right here in the cheeks, and putting some Botox in there can both feminize the jawline and also help people with TMJ issues, or temporomandibular joint or chewing or jaw problems.